You are listening to I Am Refocused Radio with your host, Shamaya Reed. This show is designed to inspire you to live your purpose and regain your focus. And now, here's your host, Shamaya Reed.
Welcome back to I Am Refocused Radio. Once again, we are here today, and today, we have a returning guest on the show. We have Dr. Ingrid Skop. She is the Vice President and Director of Medical Affairs for Charlotte Lozier Institute. I'm happy to have her back on the show. She's a friend of the show, been on here multiple times. But today we're going to talk about a topic, medical truth about abortion pill from a medical lens, what the FDA isn't telling women. We're going to learn more about this and what we can learn from Dr. Skop. First of all, I want to say thank you for clearing your schedule to be on the show again. How are you doing today?
I'm doing great. It's great to be back with you.
I appreciate your time. Understanding the headlines recently and how drugs work when it comes to the pill that everyone has been talking about for quite a long time now. For our listeners and viewers who may not know or understand how the drugs work from medically speaking, what's your take on that, on the facts, and how can you enlighten our listeners and viewers?
So the abortion drugs that we're talking about are two drugs. Mifepristone blocks progesterone receptors, so it cuts off the critical hormonal support and causes the unborn child to die. It's followed about 24 hours later by misoprostol that induces contractions to expel the pregnancy tissue. The FDA has approved this drug regimen only until 10 weeks gestational age, because if it's used later in pregnancy, it does not work well. Often the woman will have retained tissue. Some women even have delivered living babies when they've taken it too late. So that's what we're talking about. Unfortunately, the FDA has taken away many of the safeguards that supervise the use of these drugs. So now women are getting them online. They're having them delivered in the mail, even in states like Texas, where we have laws trying to protect unborn life. And so women are having totally medically unsupervised abortions with these drugs, which the abortion industry used to tell us was a bad thing, but now apparently they think it's a great idea to provide abortions without any clinical oversight.
When you look through the lens of your experience as a OBGYN, what differentiates the chemical abortion from a surgical one in terms of a medical supervision when it comes to what may or may not happen with a patient?
Yes, so a surgical abortion obviously would be performed by a surgeon. And we see that probably this is the reason that chemical or medical abortions are being promoted, because there's many doctors who do not want to end unborn life. So the abortion industry has a staffing problem. Women are being told that these drugs are safer than Tylenol, when in fact, there are 4 times as many complications from these drugs compared to surgery. So they're actually more dangerous than a surgical abortion for women. But the abortion industry tells us that 2/3 of all abortions in our country are now being done with these pills. So they're being increasingly promoted. And as I mentioned, it's a lonely experience for a woman. She is self-managing her own abortion, going through the pain. Often it's like labor. Having extensive, heavy bleeding. And in many cases, she actually does see her unborn child after he's passed out of her body.
When you think about recognizing potential complications or risks, what are some of the things that a woman should look out for? Because how quickly can a complication turn to a life-threatening situation?
Well, there is a type of infection. Fortunately, it does appear to be very rare, but very, very virulent. So women have died from taking these drugs from a rapidly progressive infection called Clostridium sordelli, which normally does not affect a woman who has a healthy immune system, but both of these drugs will suppress a woman's immune system. The FDA maintains a black box warning on mifepristone because it knows that can happen. So that's obviously the most serious thing, but many women will bleed very heavily. And the most common complication is that her body will be unable to extrude all of the tissue. This happens probably about 1 out of 20 times, 5%, when a woman is using the drugs the way the FDA has recommended, if she uses them at a higher gestational age, the risk is going to be even higher. And in that situation, she often needs a surgical procedure to remove that tissue. And many times this is done in an emergency room setting, in a crisis. So it's not the same as having chosen a surgical abortion in the first place.
Listen on Refocused Radio and watching us online, talking to our guest today, Dr. Ingrid Skop. She is the Vice President and Director of Medical Affairs for Charlotte Lozier Institute. My next question for you is, let's look through what could potentially be experienced for ER doctors. How difficult could it be for them to identify a complication has taken place from an abortion-related situation of a patient if they decided not to say that they took the medication in the first place?
Well, I think a lot of emergency room physicians don't really have it on their radar to look out for this. Unfortunately, abortion is such a highly politicized issue that we see even in the medical literature that many times they don't want to talk about it. So women are being told, often by Planned Parenthood and other abortion providers, that if they should have a complication, of course, remember, they tell them it's safer than Tylenol, they probably won't, but if they should, they can go to an emergency room, but they don't have to tell the provider that they've had an abortion. They can pretend it's a miscarriage. Now, obviously, doctors need to know what's going on clinically. We can't provide as good a care if patients are hiding information from us. But our research at Charlotte Lozier has documented that over 80% of the time when abortion drug complications, when women go to the emergency room, they are miscoded as a miscarriage. So this is happening far more often than it is not happening. And I'll tell you why it's bad for a woman. Many times, again, she has retained tissue. So she's taken misoprostol, which the intent is to expel the tissue. And if she doesn't tell the doctor that she's taken misoprostol, more than likely, he's going to prescribe misoprostol for her as a treatment of her problem, thinking it's a miscarriage and that this will help. But in fact, she's already failed misoprostol. So he's not going to be helping her. He's going to be giving her something that won't help. This will delay getting the care that she needs. And we published a study that demonstrated that women averaged 3 visits to the emergency room before the doctors finally realized that what they needed was surgery. So it does change the way that they're treated, and it does cause more harm to these women when the doctors don't know.
And with that said, that there's data out there supporting that there are some issues with that from both patients and physicians. What type of training or awareness do you think emergency physicians need to be better at knowing or identifying in order to treat chemical abortion complications?
Well, they just need to know that it is happening on such a widespread scale. Again, I practice in Texas, and so a doctor who's not very engaged in the issue of abortion probably assumes I don't need to worry about seeing abortion complications because it's not legal in the state. What they don't know is that the FDA has removed all of those safeguards so that these drugs are being ordered online, delivered in the mail. Somehow we haven't figured out how to make that stop in pro-life states. And so there are many abortions that are happening in Texas. And again, the women are often made to fear that perhaps they'll be prosecuted. Now, this is not true. No woman will be prosecuted for an abortion, but the abortion industry is more than happy to lead women to believe that they will be prosecuted. And this is another reason that women are not willing to tell the doctors that they've taken the pills because they're afraid of that. So ER doctors, just in general, I just don't think that they recognize that this is a large-scale problem, and it is happening in their emergency rooms, even if they're in a state that is trying to protect unborn life.
If a woman finds herself taking these drugs and the process fails, what immediate steps should they take when they see themselves in that situation?
Well, of course, they should seek medical care. If they're in a situation where they can go back to the abortionist who gave them the drugs, that's the way it should be. Because again, usually if a procedure is needed, it can be done in the clinic. And that's going to be abortionists should take care of their own complications. It's frustrating that they seem to think that it's totally appropriate to dump these women on the emergency room system, because as we know, our ER system is overloaded. It's extremely expensive. Doctors are very stressed out. There's a lot of patients seeking care through the system. And so this just makes the problem worse. Again, if 1 out of 20 women are seeking that type of care through the emergency room, Guttmacher tells us that in 2023, there were 630,000 medication abortions in our country. So that's a lot of women in the emergency rooms. But of course, if they have no abortionist to go back to, if they've ordered these drugs online from another state or even out of the country, they should seek care either with their own gynecologist or with the emergency room. These women deserve to be cared for. But they don't deserve to be treated the way they're being treated by the abortion industry, given dangerous drugs, not warned how dangerous they are, and then abandoned when they do have a complication.
You listen to Refocused Radio and watching us online. Talking to our guest today, Dr. Ingrid Skop, and talking about the medical truth of what you need to know about this hot topic, abortion pill. That is something that she knows. She's been on the show before. We are still talking about it. And I think we're going to keep talking about it probably throughout the year. Someone listening, watching this, what steps should be in place to better protect women, regardless of what they believe with their personal beliefs, because everyone has the right to have the personal belief. But what are some steps that can be put in place to help better protect these women from having unnecessary harm to their bodies and to their health?
Yeah, I mean, women really have been lied to for generations, and our country honestly has taken the easy way out. Instead of addressing the real problems that women face, we've merely for over 50 years offered them, well, you can have an abortion. That doesn't solve their problems. I mean, it may, obviously it's going to end that current pregnancy, but so often it's not the pregnancy that's the crisis. It's the fact that they're in a relationship that has broken down, where men so often have abandoned women who've become pregnant. The situation may be financial. It may be related to the lack of social support. One of our studies that looked at women who'd had abortions and asked them, what would you have needed? Like what did you prefer to do in this situation? Discovered that 60% of them would have preferred to give birth if they'd only had more support. A quarter of those women described their abortion as unwanted or coerced. So there's so many women in our country who are obtaining abortions because they think this is the only choice that they have, when in fact it's not the choice that they want to make. So more support for women, helping with relationships so that when a woman does become pregnant, she's not abandoned by the man who made her pregnant, and just supporting women all around. Happily, there are about 3,000 pregnancy centers in our country whose job it is, their sole mission for existence is to be there for women in a crisis pregnancy. And so they are doing a beautiful job of supporting women and helping them so often to make the choice they want to make, which is to give birth.
And for the women that you have spoken to countless hours, probably, with your service and practice and commitment to the medical world, what are some of the things that you're hearing them say with their personal experience? And are they saying they wish they knew more information, or what's some of the things you're noticing right now?
Very commonly, we get the feedback that they did not know what to expect. They were not counseled well. So women are not receiving adequate informed consent when they are taking these drugs. Sadly, I've had women that I've cared for in the emergency room when I've said, well, do you want to, complain to the abortionist, or, do you want to do something about this? They say, no, I don't want to talk about it. I feel this is what I deserved for making the choice that I made. So this is why we're not hearing about it, because women are ashamed and they feel that they deserve these complications. Of course, they don't deserve to be treated this way, but so many of them, that's kind of the mindset. So again, I want women to be counseled appropriately. If these drugs are going to be available, there should be pre-abortion testing. There is not right now. So women are getting these drugs without an ultrasound to make sure that they have a gestational age less than 10 weeks, to make sure that they don't have an ectopic pregnancy in their tubes. There have been a number of women with ectopics who've been given these drugs and suffered severe complications because these drugs won't treat an ectopic pregnancy. So at a minimum, we should be really talking to them about what to expect and what are the options, what are the alternatives. There is state support to help them give birth to their children, and of course the support of these pregnancy centers. Women are not having their blood tested for their blood type to determine if they might need RhoGAM, which prevents future pregnancy complications. Nobody's looking to see if they're already anemic and maybe shouldn't bleed heavily for 2 weeks like these drugs on average cause. They're not screening for sexually transmitted infections. They're not talking to them about contraception to prevent another unintended pregnancy. So the care, and I say that in quotes because it is not care. Women who are seeking abortion are being given such a low level of medical care that it's a shame. They should be treated just as well as any other woman when they're in that crisis. And we should let them know what to expect and let them know that there are other alternatives.
You mentioned screening earlier, so I want to follow up on that. When you understand from a professional level what ultrasound does and why it's important, can you walk the viewers through this, our listeners through this, why ultrasound can be very important prior to taking the drugs?
Well, as I said, it will accurately determine the gestational age. Some women don't know. They don't know when their last menstrual period was, or maybe they were already pregnant and just didn't recognize it. So it will prevent some of the later abortions that are not going to be successful because they're too late. Rule out an ectopic pregnancy, which needs to be treated immediately. We don't need to delay for days while we're thinking that it's a medical abortion that's happening. But also there's a couple other things about ultrasound. One is that we know statistically, if a woman sees her baby on ultrasound, she's not as likely to choose an abortion. And that may be one of the reasons the abortion industry doesn't want the women to see their baby, to see that they have a heartbeat, to see that they have arms and legs and are moving around and are visibly human. So, that's certainly a very important thing about the pre-abortion testing. But these these drugs are just being mailed in from out of state. They're being mailed sometimes from Amsterdam or China or India. So we know that those are women who essentially are being abandoned and neglected by the industry, who just wants to sell them an abortion and they don't care what happens after that. And I also want to mention, They are now promoting to women that they get these drugs in advance of pregnancy. They call it advanced provision. So they're saying, have them in your medicine cabinet just in case you get pregnant. So what I've seen happen is that women may have a positive pregnancy test in a moment, in an emotional moment, or in a moment of, fright. They may say, oh, I'm going to take these drugs. And then within hours, they regret that decision. So we can reverse the effect of mifepristone by giving high-dose progesterone. It'll compete for the receptors and in many cases will save that baby's life. But I have had so many calls from women requesting progesterone, which they find out about on the internet, because they took the mifepristone and then decided they didn't really want an abortion. So this is clear evidence that women aren't really considering this action completely, and they're not being given all of their options and alternatives if they're taking the drugs and then asking to reverse the process almost immediately.
Once again, listen to Refocused Radio and watching this online, talking to our guest today, Dr. Ingrid Skop. She is Vice President and Director of Medical Affairs for Charlotte Lozier Institute. I know you got a lot on your plate with your calendar, so to wrap this up, I would say, from educational piece for women out there who watch this or listen to this and they're interested in learning more information, right? I want to give that positive, polite invitation. What additional resources are out there for them to read more about these topics and just resources that can help prepare them to make a better decision?
Yes, thank you so much for offering that. So the organization I work for is called Lozier, Lozier Institute.org. Our website has quite a bit of information. I am also a member of the board of the American Association of Pro-Life Obstetricians and Gynecologists. Their website is AAPLOG, AAPLOG.org, and they also have quite a bit of good medically accurate information for people who want to learn more. So we all need to educate ourselves so that we can tell women really what is truly going on.
And last, it's promised not a bad curveball, but one more question. For the women that you've talked to in your health care professional career who are mothers and became mothers, what are some of the things that they talk about when they experience motherhood for the first time and caring for a child, if you don't mind?
Well, motherhood is hard. Giving birth is hard, but it is so rewarding. I've never had a woman say to me, I wish I had not done this. When that child is in their arms, all of the preceding difficulties and pain are gone. So again, obstetrics, childbirth is a beautiful thing to go through. And I'm so blessed to be able to help women through this time of life. But going for the easy way in life is not the way to happiness. But sometimes doing the hard thing is the way to really unlimited satisfaction.
Well, on that note, I want to say appreciate that perspective. We've been talking to our good friend of the show, Dr. Ingrid Skop. Like always, I want to say to you, thank you for your time.
Oh, thank you so much for having me again.